infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, the United States is in the grips of a third wave of the coronavirus pandemic, and the numbers are rising at a rapid pace. A vaccine is what public health officials are banking on to get us out of it. With that, viral mutations are a concern. Well, my guest today is screening wastewater for the presence of COVID-19 to determine if the virus is circulating and different strains of the virus are cropping up. So joining me now is Edwin Oh, PhD. Dr. Oh is an associate professor at the University of Nevada, Las Vegas School of Medicine. Dr. Oh, welcome to the show, sir.
Hi there. Thank you for having me.
So you and your team have been working on screening wastewater for the presence of COVID-19, the SARS coronavirus 2 virus, and more recently extracting RNA from the virus and determining if and where different strains of the virus are cropping up in different communities around Las Vegas. So testing wastewater for COVID-19, what can we learn from this analysis? And what have you seen during your surveillance activity in the Las Vegas area?
Right. Well, so screening wastewater, the concept itself is not necessarily new for infectious agents. In fact, this has been done back in the time of the development of the polio vaccine, where wastewater and the surveillance of wastewater has pretty much revealed how much of the virus is present in various communities. Right. So how much? Are there weeks where you see a little bit more of it? Are there weeks where you don't see any of it? What we've been developing recently with a number of folks across the nation is the ability to sequence this virus from the wastewater. And the reason that this is more of a recent development, really something that has not happened even since COVID-19, is because the technology to accomplish this type of experiment has not really been that readily available until really within the last 10 years or so for labs like ours. And using this technology, we've been able to screen the wastewater and look for viral mutations, a task that's usually done using clinical isolates from single human beings. When we take this wastewater, we can essentially take a sample that is an aggregate of the entire community and look for pretty much all variants that are represented within the communities, and determine whether there might be certain clades or certain strains that are present in one part of Nevada versus another.
Yeah, and we've seen some pretty promising results coming from Moderna and from Pfizer concerning vaccines, pretty high efficacy rates. Now, this work that you're doing with the sequencing, that can really help in the effort of making vaccines, right?
I feel that the effort that we are participating in, the effort is one of the collection of information about a virus that we know so little about, right? This is something that showed up in this nation 9, 10, 11 months ago. And every day when I come into the lab, I'm learning a little bit more. And what we've been finding is that there is variation within this virus. Now, I'm not an infectious disease expert. I'm someone who really understands the sequencing of human genomes and other mammals. And I'm taking this technology and what we're realizing is that there are all of these different variations present in different communities. Now, do these variants then lead to possibly a certain strain of a virus that might be resistant to a vaccine, that's a little too early right now to conclude, but it's certainly a fear that many of us have at the back of our minds, right? And it's something that we want to track over time. We know that COVID-2 is the second iteration of this coronavirus that has hit the world, right? The first iteration of COVID-1 showed up in Asia back in 2003. And we know that over time, over the last 17 years or so, COVID-1 changed, mutated into what we know of today. So we fully expect COVID-2 to evolve, whether it's going to take a year, 5 years, or another 17 years. We don't know, but we do know that it will mutate over time. And that's really why we're doing this research. We're doing these surveillance studies so that we can track this virus as it mutates. We don't know the conditions that lead to faster, more rapid evolution of this virus. But it's something that we're prepared for now, I think, versus 9 months ago.
Sure. And I probably should have asked you this earlier, but you've mentioned the technology. We have the technology now. I'm assuming, are you talking about whole genome sequencing?
That's right. I was going
to say, can you explain that to the audience in case some listeners aren't unaware of this technology, please?
Sure. So you and I, we have 3 billion nucleotides, and that makes us who we are as human beings. A few changes in those 3 billion nucleotides make us Asian, African American, Northern European descent. It gives us these changes, gives us blonde hair, brown hair, black hair. It makes us who we are. And with the virus, this is 30,000 nucleotides. So over the last 10 years or so, the technology that's required to amplify this virus and then basically read all of these nucleotides, all 30,000 nucleotides, has become a lot more inexpensive. And it's something that we can run in the lab for a few $1,000s versus a few $1 million 8 years ago.
Now, your team at UNLV has been collaborating with the University of Arizona. Dr. Oh, can you talk about this collaboration and what you have learned from it, the work you're doing?
Right. So wastewater surveillance, the concept of wastewater surveillance and the ability for a program like this to prevent an outbreak has never really been tested in the past. It's been a program that's been used to surveil perhaps in a retrospective manner. What happened here with this program was it was put in place when students were returning back to campus, and this program was able to lead to the identification of 2 asymptomatic students in a dormitory. And because of the wastewater surveillance, we were then able to identify these individuals and quarantine them, thereby preventing a potential outbreak, right? Thereby potentially preventing local transmission of an infectious agent. What we're doing here at UNLV is we're now taking this wastewater and we're sequencing it, right? Because the type of surveillance program that we really want to have in place is one where we can match that wastewater sample, that genome, up to the actual individual. The challenge with college campuses, with various residences, with various vulnerable residences, is knowing whether you've identified patient 0, whether you've identified the individual who's shed the virus. Using sequencing, genome sequencing, we can now take that sequence that we've identified from the wastewater and eventually match it up to a student or to another human being, right? And thereby identifying who the individual might be that shed that virus. with a college campus, we're always worried that a parent, a girlfriend, a boyfriend, right, a colleague uses the bathroom and then leaves, and as a result, we end up having to screen all of the students. And if we're lucky, we find something, and if we're not, we don't, right? So this is something that we're learning about and improving as time goes by.
Yeah, and you mentioned screening for poliovirus, and they screen environmental samples in Afghanistan and Pakistan all the time, coming up with stuff. Is this research you're doing applicable to any other infectious agents?
Yeah, absolutely. Again, really, none of this was really, I think, something that was put into place. The sequencing aspect was put into place right off the bat, because it's never really been done at this scale. We've known about next generation sequencing and the ability to sequence whole genomes, but the utility of this technology with environmental samples has, for the most part, has not been done at this scale. And I think more and more folks like myself are trying to figure out ways that the technology can be applied. So, case in point, if you have, let's say, an enterovirus, a stomach flu that's floating around in an elementary school, you can pick this up pretty much using whole genome sequencing from wastewater. You don't have to test each and every child anymore. You can have a program in place where you're screening once a week, 3 times a week, looking for the presence of such viruses. So the reality is we can pick up pretty much we can pick up a large number of infectious agents using this method. Right.
So Dr. O, where do you see your research? What's the next step? Where are we going from here?
Yeah, so we want to improve on what we're doing. Extracting viral RNA from clinical isolates from nasopharyngeal swabs, that's really easy in the lab. Extracting viral genomes from sewage is a little bit more challenging. These virions are floating through water that's containing harsh chemicals. So these chemicals end up degrading part of the genome, and our task is to be able to purify that genome and be able to amplify it before we can sequence it. So we are still working on the technology to improve on the efficacy of the technique with regards to genome sequencing. We're also looking to develop new technology to identify the protein, the spike protein that's present on COVID-2. We want to use peptides of this protein from wastewater and be able to show using a different technique that COVID-2 is really present. The goal here is to be as sure as we can about some of the conclusions that we're trying to make. Again, right, when we're looking at variants that are floating around in a community, we want to know whether these variants are pathogenic, whether they can lead to a new version of COVID-2 that's more infectious. And in order to do that, we need to be able to collect information that we're confident about. So improving on these techniques is going to take a little bit of time. And that's what I believe my colleagues and I are investing a lot of our days and nights and mornings thinking about as we come into the lab to improve on the technology. So that, again, we can confidently reach that conclusion that we see 50 new mutations, and we can then translate those 50 new mutations into a functional score, meaning are these 50 mutations leading to a more negative outcome, or are they just truly benign?
Well, it's definitely some fascinating work, and it's really mind-boggling where laboratory testing is now compared to when I went to lab school back in the 80s. It's just night and day, right? So it's great stuff. Dr. Oh, any final thoughts on your research or the work you're doing?
Well, I would encourage folks to learn more about all of the different efforts. So we need people invested in this. We were caught off guard by this infectious agent a year ago, and I think with more people informed by what's going on in labs, in public health labs, I think we're gonna be in a better position the next time an infectious disease hits. This is not a if it hits, it's when it hits, right? And
Right.
when the community understands that contact tracing, wearing of masks, cleaning of hands, all of these measures that the CDC is putting out are important. I think we're going to be in a place where I think a lot of countries in Asia are right now, where the number of cases that they're seeing every day is in the range of single digits, 1, 2, 3, 4, 5. We're looking every day at over 100,000 cases, and for a country like ours, that's just unacceptable. And my hope is that with information, the public will be in a better position to deal with this the next time this happens.
Okay, very good. And I want to thank you, Dr. Edwin Oh, for sharing your time and your thoughts and your research with us. I really appreciate it.
Thank you.